So, this is a closed section. This patient is on ventilator. So, if you want to remove the secretion from the endotracheal tube, you need to use the closed section. Closed section avoids the decreases the contamination spread of microorganisms, all those things. So, it is very good compared to the open section. So, how we will do this closed section is this is a complete tube suction catheter will be there. So it is covered by the plastic wrapper, and there is a marking on this. You will have a, this is a 14 French closed suction catheter. Here we will have a marking. If you want to do suction, first 4 centimeters it will go inside. You can clearly see in this transparent chamber. So this 4 centimeters is it is in a dead space. Okay, then slowly gently you will push it to the ET tube. Okay, so you can see the length, how much it is going inside. Here it is a marking how many centimeters it is going. After inserting inside, then you need to apply the suction by pressing this valve. Okay, you press this valve and gently remove. This has to be done within the 15 minutes. So suction should be done within 15 minutes, 10 to 15 minutes. Like this, gently you need to remove. And here you have another chamber. So that is to clear the secretions in this closed suction chamber. At a time you push this normal saline and press this valve, then automatically it will get cleared. So this, if you see this closed suction catheter, you will have a 3 different openings. This opening you will connect it to the ET tube, and another port you will connect it to the HME filter that is connected to the ventilators. And another side you have a suction catheter. So this is for clearing the secretions in the ET tube. So that is connected to a 50 ml or 20 ml syringe, which is having a normal saline. So gently you push inside the ET tube up to the mark and then press this valve, so automatically suction is coming. So this patient is having a clear bleeding, active bleeding in the lungs, so that's why these secretions are coming in a red color. You can easily see these things. And if you want to, before doing this suctioning, you need to do the hyperoxygenate the patient. So you have to press in the ventilator, that is a closed suction button.